I think I'm here. Hello, this is Dr. Dave Pascal, and this is our talk today on CRPS, in particular, the role that your gut or your digestive tract plays in CRPS. And we're definitely going to be taking questions for those of you that are out there. So start thinking of things to ask me. I want to welcome you all. CRPS, complex regional pain syndrome, is a very serious, complex disease process where people have off the chart, really unchartable pain levels. And it can be in one area like your foot, or it can be full body. I've seen patients where there's literally no place that you can touch the patient at all. Their face, their arms, their hands, their legs, their body, everything is, on a one, most people use a 1 to 10 pain scale. A lot of CRPS people will use a 1 to 20. And, 1 to 20 means that at 20, nothing that you do to that person will increase their perception of pain. It's already so horrendous. And with these patients that you can't touch, you need to be able to treat them. If you can't touch them anywhere in their body, you still need to find a way to treat. And I've developed a whole system for that. Of course, if someone only has CRPS in one specific area, let's say their foot, then that gives you a lot more treatment options. But today, I really want to focus on the role that your digestive tract plays in CRPS, because 70% of your immune system is in your small intestine. And also all the subproducts for your neurotransmitters, which are the chemicals that carry your nerve signals, those subproducts are made in the small intestine, go up to the brain through the blood-brain barrier, and then they're assembled there. So when you damage the small intestine, you are impacting the body in two main ways. The first, as I said, is in an immunologic way, and the second is in a neurotransmitter way. With CRPS, there are many contributing factors. We know that hormones are a factor. We know the immune system's a factor. We know that the sensory part of the nervous system is totally out of whack. It is not regulating it at all, itself at all. And when your body has an injury, the thing that heals your injury is your own immune system. Well, that is being regulated, and precursors for that immune system is in your small intestine. And your small intestine first is absorbing all the nutrients that your cells are made out of. Every cell, tissue, and organ in your body is made of the things that you are eating. Well, if your small intestine is off, if you have food sensitivities or food allergies, then by definition, you are not absorbing the food as you should. You're not absorbing all the nutrients. And the nutrients that you are absorbing are usually creating a lot of inflammation. And it's not just inflammation in the small intestine, it's inflammation in the blood. And when you have inflammation in the blood, then that is going to damage your arterial walls. And when the arterial walls are damaged, then the liver gets involved to come and help heal the arterial wall damage, and that's primarily with cholesterol. And so people with CRPS are going to have elevated cholesterol levels because they have increased inflammation. Increased inflammation is causing increased arterial wall damage, and so therefore high cholesterol levels. One of the big mistakes that medical doctors will make is they'll see the elevated cholesterol levels, and then they will try to address that by giving CRPS patients drugs that will lower their cholesterol levels. Well, that will inhibit the body's ability to heal itself. You need to go to the underlying cause, which in this example is sensitivities and food allergies. So in my office, we use a program that I developed, a technique called Faze, Pascal's holistic allergy and sensitivity elimination technique, where I can test each individual to see what they are sensitive to, what they're allergic to, and then treat them for each individual thing. And that will reset the body's immunologic response to the foods that they're eating. That benefits a few ways. One is it greatly lowers that inflammatory reaction that the food sensitivities and allergies are causing. And the other thing is now the body is able to absorb the food that it is taking in. Excuse me, frog in my throat. The other part of that with a damaged small intestine is the neurotransmitter factor. So when our small intestine is damaged, as I mentioned at the beginning, we're not getting our neurotransmitters, the subproducts made correctly, and so that's going to impact our dopamine levels, our GABA levels, our acetylcholine levels, serotonin levels. And that in turn will affect our emotional state. It's bad enough to be in chronic pain, and many people with CRPS will have subclinical or clinical depression, which is totally normal because you're in horrendous pain. Of course, you're going to feel terrible about that. But when you, on top of that, upset the neurotransmitter levels, then we can't have a more appropriate, normalized thought process about our condition. And that makes it much more difficult when we lose our ability to have linear thought without brain fog, without normal neurologic function. So I'd like to open up this live to any questions that people have, in particular about gut, but we will take anything if someone would like to reach out. How we looking there, Danielle? While Danielle is looking at our questions, I can continue a bit more about the role of our GI on CRPS. We talk about how our neurotransmitter levels are off, and it's kind of difficult to directly assess neurotransmitter levels in the brain because the molecules are too big to pass from the brain back into the bloodstream and then be able to measure our brain neurotransmitter levels with a blood test. Unless there is some major damage to the arterial walls in the brain causing the neurotransmitters to leak from the brain into our bloodstream, we can't assess neurotransmitters with a blood test. We can do it with an autopsy, which is what we can do once someone is deceased, and so of course that's not going to help all of our living CRPS patients. The other thing, and the best way, therefore, to assess individuals' neurotransmitter levels is with a questionnaire, because research scientists have been studying the brain for forever, and more in particular the last couple hundred years, we really have honed in on the role of each neurotransmitter in terms of our thinking ability, in terms of body function, in terms of our emotions. And therefore, we can quite accurately assess an individual's neurotransmitter levels with a questionnaire. So part of my intake exam in my office is to have our patients fill out a neurotransmitter assessment form, and that will give us insight into an individual's current neurotransmitter levels. And once we have that information, then if some levels are low, we can use different ways to increase their neurotransmitter levels. And I may or may not get into that. Where are we at?
So, how much does a person's gut microbiome affect the disease's course and treatment?
So if you didn't hear that question, it's how much does someone's microbiome, does their gut impact CRPS? That's a great question, and there's no definitive answer because there are so many different factors involving CRPS. Who's to say that one particular thing has a greater role, let's say hormone levels versus gut health, like leaky gut and food sensitivities? To me, you have to address all the causes, and whether it's 20% of the problem or 80% of the problem, you need to, I believe, whatever doctor you're seeing, and of course in my office, you need to correctly assess the state of someone's gut health, and you need to assess their hormone levels. You need to assess what's going on with the sensory part of their nervous system, not just their pain nerves, but all of the other sensory nerves that are sending information back to the brain, like light touch and temperature, vibration. And then do your best to bring those individual things back into normal function. So if someone has some type of gut biome issue, they have leaky gut, they have some food sensitivities, whatever it is, I don't think of it as, okay, well, this is 20% of the problem or this is 73.7% of the problem. I just go, it's part of the problem. And then do the steps that it takes to make the GI as healthy as possible as part of an overall treatment program for CRPS.
Can simply changing your diet help?
So the question is, can simply changing your diet help? Well, it can help. It's like if you have a hole in your roof and it's raining and it's leaking, you can put a bucket under the leak. That'll help. That doesn't repair the leak, but it does minimize the damage that the water's going to do once it hits your wooden floors. If you eat less things that are creating inflammation, then you will have less inflammation. But let's say you are sensitive to egg protein, and when you eat egg, that creates inflammation in the intestines and in elsewhere in the body. Yes, you can help by avoiding eating eggs, but you aren't correcting the problem. And from my viewpoint, food sensitivities and food allergies are a glitch in your immune system, and it's your immune system that heals you. Yes, the symptom that you have is you eat eggs and you break out into hives. But what you don't see is the role that sensitivity, how much that sensitivity is hampering your immune system's ability for cellular repair, for tissue repair. And therefore, yes, you'll help yourself to some extent by not eating the eggs, by avoiding the eggs. But the bigger picture is, okay, you did that, but now what are you going to do to reset, normalize, boost your immune system?
What are your thoughts on prebiotic, probiotics, and digestive enzymes?
Yeah, I think that prebiotics, probiotics, digestive enzymes are all good things. We have, I can't remember how many tens of thousands of different bacteria in our, good bacteria in our gut. And most of these probiotics that are sold are, 5, 6, maybe 10 of the most common ones. So it can be helpful to supplement those, but a better way is a natural way, and that's to eat more raw, unprocessed foods, fermented foods, and restore your gut biome in a more natural way. And also in terms of the digestive enzymes, again, if your body is low in digestive enzymes, then my question is why? We are trained from all the millions of TV commercials that we've seen and other commercials and TV shows that are all symptom based. Have a headache, take aspirin. They never say, why do you have a headache? Right? Need low on digestive enzymes? Well, take our digestive enzyme. They never say, why are you low on digestive enzymes? Have pain, take a painkiller. This is a symptom approached, symptom based approach to healthcare, and that is what Western medicine preaches. That is their world, but that is rarely addressing the underlying cause. So again, in my practice in the system, the Pascal method that I developed for CRPS, I'm trying to find the underlying cause of all the dysfunction in the body and do my best to bring the body back to normal function in as many different ways as you can. And the more ways that you do that, then the body will slowly re-regulate itself and get the ability to heal itself and recover.
This is going to be the last one. What should I expect as a patient while I'm going through the process of healing my gut?
So the question is, what should I expect as a patient as I go through the process of healing my gut? I assume symptom-wise, what you're feeling. What happens is patients they'll have less brain fog. They will have less digestive issues, less obvious skin issues, whatever your symptoms are that you have from food sensitivity or food allergy. As we address each one of those individual items and your immune system slowly rebuilds itself, you're going to have less and less symptoms, obvious overt symptoms. You're going to have less and less symptoms that you're not even aware of. You're going to be increasing brain function. So besides those physical things like fatigue and skin conditions and GI disturbances, you're going to have ever decreasing brain fog. And it takes a lot of energy to fight all of this inflammation. And so the other thing that will happen is your fatigue is going to be going down. Your energy levels are going to be coming up. You'll be sleeping better. Pain levels will go down. It's a major, major role in the healing of CRPS or putting CRPS in remission. As you heal the gut, then that is part of that major road to remission. So I hope all of this information was helpful. If you have more questions, you can wait till next week. We are on here every week. We're on the East Coast, so it is 1 o'clock on Tuesdays, or I'm sorry, 2 o'clock on Tuesdays, 1 o'clock Central Time. You can reach out and ask us questions, or if you don't want to wait a week, you can email our office at drpascalhelps@gmail.com, or reach out on our group in our Pascal Health Institute Facebook page. We have the CRPS Solutions group, which is probably where you're seeing this right now. I hope you all have a great week. I would love to answer any questions and, of course, help anyone that needs my help toward moving into remission. So have a great day.